www.healthcmi.com. Acupuncture, continuing education online. Today, acupuncture and herbs ameliorate endometriosis. Published November 6, 2017 at healthcmi.com. Go ahead to healthcmi.com, click on news, and you can take a look at the whole article. Gives you the success rates. Here, acupuncture was compared with drug therapy and came up equivalent. So it's an excellent treatment option for patients with endometriosis. So the researchers compared RU486, a synthetic steroid, with acupuncture plus herbs in a protocol, and they were both effective, very effective for helping patients with endometriosis. However, acupuncture and herbs has a lower adverse effect rate. Most people know of RU486 for its use as an abortifacient, but it's also used for endometriosis as a synthetic steroid. So ultrasound imaging, found that acupuncture and herbs, along with the drug therapy in a separate control group, are both effective for reduction of endometriomas and other growths. And also blood tests showed that acupuncture and herbs significantly lowered cancer antigen 125. So that's also very important. And the positive rate for anti-endometrial antibodies was also significantly lower in the group having acupuncture and herbs. And of course, the drug therapy also was successful in achieving this. So endometriosis is a condition where endometrial cells are displaced outside the uterus and it's lining the endometrium. Dysmenorrhea, painful menstruation, chronic pelvic pain, and painful intercourse or infertility are very common in patients with endometriosis. Optimal treatment protocols are paramount because research indicates that there is a gradual rise in endometriosis patient numbers over time. Conventional biomedical treatments include steroid medications and surgery, which is, of course, why RU486 was chosen here. And a troubling symptom of endometriosis is usually moderate to severe dysmenorrhea, that is, cramping and pain during menstruation. And this is due in part to overproduction of prostaglandins from abnormal growths. So the authors of this investigation cite prior research demonstrating that acupuncture has a homeostatic and regulatory effect on prostaglandins production, thereby contributing to pain relief. And they add that acupuncture has been shown to adjust pain thresholds, prevent the spreading of endometriosis, and reduce endometrioma size, so the growth sizes. And acupuncture and herbs can reduce the proliferation of abnormal bands of fibrous tissue. They map out the exact acupuncture points, the herbal medicine used, how they got the job done. So one of the key points was CV3 Zhongji, another one was stomach 36, and of course the indispensable stomach 25 point, Tianshu, is also used. And they map out very specific details on what points to use and how to modify that for specific cases. The blood test results in the ultrasonography were definitive, showing that acupuncture plus herbs works. So this goes to another level because the cancer antigen, CA125 is a very important number. Now, an elevated number of CA125, cancer antigen 125, may be the result of endometriosis or may indicate ovarian, fallopian, endometrial, or peritoneal cancer. So acupuncture successfully lowered that antigen rate. And higher CA125 levels are correlated with increases in the severity of dysmenorrhea. So this is why this was used as a marker. And the positive rate for EMAB, the anti-endometrial antibodies, was also assayed because immunofluorescence reveals that positive EMAB rates are higher in women with endometriosis. So take a look at this article. Acupuncture plus herbs had a total treatment effective rate of 90%, so getting good results for over 90% of the people here, or 90% of the people, and the drug therapy produced similar results at 86.67%. So roughly equivalent. Acupuncture and herbs did edge out and beat the drugs technically, but these numbers are very close. So when you're within 3 or 4 percentage points, it's considered equivalent. Take a look. If you're an acupuncturist, of course, you're going to love looking at the herbal formula and the modifications and the herbs. As a layperson, it's great to see what to expect, what the treatment options are, a little bit about the blood work, a little bit about the ultrasound results, and what someone can look forward to in terms of getting results, relieving pain, overcoming infertility. There's so many things that can be achieved in a positive way. So take a look at that article. Go to healthcmi.com. Click on news. And this article was the one published November 6, 2017, entitled Acupuncture and Herbs Ameliorate Endometriosis. Thank you for listening. www.healthcmi.com.